Also. All right. Good morning, good afternoon, good evening, depending on where and when you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan, CEO, founder of Living Spring Family Medical Center here in the amazing city of Mansfield, Texas. And we're here again doing another Facebook Live discussing topics and helping our patients live long and well because we do believe that the quality of life is just as important as the quantity of life. And I have the awesome Dr. Catheryn Coleman who's here with us today. Good morning.
Good morning.
Um, Thank you for coming. I know that your schedule is busy, so I appreciate you taking the time out to come enlighten our viewers. So thank you.
Happy to do it.
All right, awesome. So today we're talking about the topic, Doc, I'm told I have a hernia. What does that mean? All right, so I know I already mentioned your name, but please, for those who are watching, oh, by the way, watching live, hashtag live, watching in replay, hashtag replay. But please, Doc, please introduce yourself. Who are you and what do you do?
So I am Catheryn Coleman, and I am a general surgeon in Arlington and Mansfield, Texas areas.
Yay, we like what you do. And spoken like a surgeon. I love your notes. Spoken like a surgeon. All right. So why do you do what you do, Doc? For those who are watching, like why do you do what you do?
So honestly, I didn't think I was going to like surgery. As a medical student, I actually put my surgery rotation first because I wanted to get it out of the way. And then I did it and I really enjoyed it. And then I spent the next several months trying to talk myself out of the fact that I enjoyed it. And then, over time, I just realized the operating room was my happy place in the hospital. I loved working with my hands. I liked fixing things. Somebody came in with a problem, we would take them to the OR. They would leave the hospital without the problem. And that's just what I really enjoyed doing. And I figured out that that's what I was meant to do.
Awesome. When you know.
Exactly.
You try to fight it, but you just knew. And
can't.
I'm happy that you did because you're here. Yes. So this is good. All right. So we're going to delve right to it. What is a hernia? What is a hernia, Doc?
So a hernia, there's multiple different types. A hernia is essentially a defect or a hole in the abdominal wall where stuff like fat or potentially small bowel or colon can protrude through that defect.
Okay. So that's what a hernia is. A defect through which things kind of poke through.
Look out.
You feel the bulging. How does one get a hernia?
So hernias can form kind of almost a natural weak point. So like in the groin or inguinal hernias, it's kind of a natural weak point in the body where you can get a hernia. The umbilicus or the belly button is kind of a natural weak point where people can get hernias. In addition, previous surgical sites are weak points because the body never heals back to its original strength. So that weak point can be an area where you can form hernias. In addition, like straining, overexerting yourself can sometimes cause hernias or anything that increases like intra-abdominal pressure. So pregnancy, obesity, people who are like COPDers or smokers who have a lot of chronic coughing can be at risk for hernias. In addition, we think some people have some kind of genetic defect with their connective tissue. I mean, there are like things like Ehlers-Danlos, but even more so than that, we think some people for some reason have a weaker connective tissue than others, making them a little bit more prone to hernia formation.
Okay. And weightlifters too, right? Those who lift weights. Yeah, I got a few of those who come in with hernias because of those. Yes. All right. So is there anything to do to prevent a hernia? Let's say I have patients who's watching, like I had one. It was fixed, and then I got another one. Like, what can I do to prevent one from reforming? What would you say?
Sometimes there's not a whole lot that one can do, but the things that you can do to try and help prevent them is, maintain a healthy diet, healthy weight. Because being overweight puts more pressure in the abdominal wall, makes you more prone to forming a hernia. So healthy diet, healthy weight, maintaining your core muscles, so your core strength, and doing some core exercises can help. Using proper lifting techniques. So like bend at your knees, not at your waist. Don't lift something that's too heavy for you. If something's too heavy, get help. Things like that can help prevent.
The proper form, healthy weight, healthy diet too, all can help with preventing hernias. All right. So I have a patient who says, you know what, I've been told I need a hernia surgery. I'm very nervous about what that could mean. What would you say to that person as far as like the need for hernia surgery? When should
Right.
someone get a hernia surgery?
So, hernia surgeries most of the time they're not urgent. They're things that people, we don't have to rush into things.
Okay.
I usually tell people that if they're symptomatic, so if you know that it's there and that it bothers you, then we probably should fix it. Hernias aren't going to go away. They're always going to be there. There's that hole is there until we surgically fix it. And most of the time, hernias get larger over time. So they're easier to fix when they are small.
Okay.
Um, in addition, hernias can become surgical emergencies. It's not super common, but it can happen. So a piece of bowel can get caught in there, twisted, lose its blood supply, and that's something that we have to fix urgently. And so when hernias are small and they're elective and they're at that point where they're a little bit more easily fixed, I kind of counsel people on it's better to fix them sooner rather than later or find us in a situation where, we're not in the most ideal of circumstances.
Mm, okay. Thank you, Dr. Mitra. She did make a comment. Hi, Dr. Mitra. Thank you for joining. She says, back to a healthy diet. Healthy weight, of course, will help with preventing or minimizing the risk of hernias. And as for the surgery, we want to do it sooner than later. So when it's not urgent or emergent, so it doesn't become a bigger problem down the line, right? And
Mhm.
of course, if there are symptoms, if it hurts or, it's affecting the quality of life, then that's a time to definitely consider the surgery. Now, how do you encourage patients to prepare for the surgery if they had to do one? How what would you say to prepare to better optimize the outcomes of the surgery?
Sure. Weight loss. So for certain types of hernias, I will actually not fix them if their BMI is over 35. So for ventral hernias or incisional hernias, I will not fix them with their BMI over 35 because the risk of recurrence is almost 100% at some point.
Okay.
Now, groin hernias are a little bit a different story. Um, so I will fix those kind of regardless. In addition, if people smoke, I will not fix hernias or ventral and incisional hernias in patients who smoke. There are a lot of wound complications, increased infections with those bigger hernia operations. So quitting smoking, weight loss, um, making sure, if you're a diabetic, making sure your sugars are controlled preoperatively to decrease your risk of wound complications and infection, those kinds of things.
All right. And I wanted to highlight something you said because sometimes, um, you know, our patients who are generally overweight or obese, get, they may take some things maybe a little bit too much to heart. And I'm hoping I'm using the right phrase in saying this. It's not that, oh, you're overweight, you're obese, I'm not going to do surgery on you. It's
Correct.
the risk is if we do the surgery, it will come back
Correct.
almost at 100% if we do the surgery. So there's no point. So it's almost like saving you the headache of having
Correct.
to do this over and over again. And so I wanted to highlight that the reason because you mentioned that also before. And then smoking, the wound infections. I've seen people get pretty complicated wound infections, and so the way to minimize that is not to do the surgery if you smoke or quit smoking. So please, of course, these are medical suggestions. See your doctor to have an individualized plan, but see your doctor, get help with quitting smoking, so you optimize, the chances of you doing very well after the surgery. It's not just the surgery; it's how you recover after. So that's a big deal. I have a question here. Someone says, "Well, what's the recovery like? Like when can the patient go back to normal activities?"
Right. The hernia surgery, majority of the time, is a day surgery. So you're going to come in, get the surgery, go home same day. The recovery period, most of the time, I'm able to do this surgery minimally invasive, so tiny incisions. So you're going to be sore for 2 to 3 weeks, but every day it should be getting better. I would say the biggest thing that's hard for people in the post-op period is no heavy lifting. So nothing over 10, 15 pounds for 6 weeks because that puts strain on that repair, and we want to let that repair heal as well as it can without putting any strain on it. So no heavy lifting post-operatively. So people have jobs where they have to do a whole lot of heavy lifting. They either can't work for that time period or they have to be on light duty. And my office can get people notes for that. But that is something that I really enforce for post-operative hernia surgery.
Okay, and that's where the surgical consult will come to play, where you have those discussions. So, when the patient comes to see you and you say, okay, these are things you'll be able to do after, these are the expectations, and people can adjust as needed. All
Correct.
right, great. So someone's asking, Dr. Mitri is asking that question again, smoking. Can you please clarify, is that due to wound healing issues strictly? Like, why is smoking such a big deal?
It's wound healing. And honestly, with things like inguinal hernias, it's a little bit less of an issue. And like I said, most of the time I'm able to do this with small incisions, so it's not as big of a deal. Inguinal hernias have a very low recurrence risk. And so smoking doesn't quite, the literature or the data doesn't say that smoking actually really affects the recurrence of inguinal hernias very much. Now, ventral hernias, incisional hernias, those hernias at baseline have a higher risk of recurrence, and smoking affects the way that a wound or that hernia is going to heal. And so again, it puts you at a disadvantage surgically in terms of you're at higher risk of recurrence. And so I won't put my patients at a disadvantage. I want to be able to fix their problem, and ideally, it doesn't come back and bother them in the future.
Right.
So I don't want to put them through a big surgery when their problem might come back.
Okay. That is fair. That is fair. And you did talk about it, different types of surgery based on location, right?
Yes.
Or different types of hernia based on location. The inguinal closer to the private areas, and then the ventral, the groin areas, and then the ventral more around your abdomen, belly. All right. So the location also plays a part.
The location also plays a role.
Awesome, awesome. So there we have it. We know our options, ways to optimize our risks of, or minimize our risk and optimize our healing and recovery. So Doc, I have people who are watching who are like, wow, this is awesome. This is very informative. I love how you're straight to the point and you answer my questions. Where can people find you? Where can people connect with you, Doc?
Sure. So I'm part of a group. It's North Texas Surgical Specialists. So you can Google us, Google my name. Our website is ntxsurgical.com. My particular office is right across the street from Medical City Arlington on Omega Drive. And all that information, the address, phone number to my office is on our website. And so you can call my office and make an appointment with me.
Awesome. And what I'm going to do is after the live, we're going to have that information posted in the comments so people also can reach out to you. I do have another question. Someone's asking, if patient has had laparoscopic abdominal surgery in the past. Well, I'm impressed at the level of this question. Laparoscopic. Okay. If patient has had laparoscopic abdominal surgery in the past, is one at a higher risk, or should they be dissuaded from abdominoplasty?
That's not going to affect an abdominoplasty at all, especially if it was laparoscopic surgery. That's not going to be a problem. Abdominoplasty would not affect that.
Okay, the incisions are smaller, so it shouldn't be a big deal.
Correct. Yeah, and the scar tissue is minimal with laparoscopic surgery, so that's fine.
Okay, so yes, you have an option. That shouldn't be a deterrent. So see your surgeon, or come see Dr. Coleman. Fly over here. I should take care of you. Okay. Thank you so much, Doc.
Thank you for having me.
Oh, my pleasure, my pleasure. And we'll have you again discussing other surgical issues maybe in the new year.
Love it. Sounds great.
Awesome, awesome. All right, thank you all for watching. If you know someone who could use this video, please share it with them. Remember, caring is sharing, sharing is caring, okay? And on that note, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician whose joy is to help you live long and well, I am she. Have a good one, guys and ladies.
Bye.